deep breath and let it out. As you allow air to be pushed out, that is passive. Your thoracic cavity is getting smaller as the muscles relax and the diaphragm moves up and the ribs move back down. You would only use the internal intercostals when you're trying to force air out. So take a deep breath. Let the air out. Now force it out. You can start to feel your abdominal muscles work and your internal intercostals. Those are only used in forced expiration. Normal expiration is considered passive without the use of muscle. Expiration is passive. When we do use expiration muscles, that's a forced expiration. Okay. So normal inspiration is going to involve the contraction of the external intercostal muscles and the diaphragm. So we're ready for the last muscle for today. And that's the diaphragm. This is looking up from the legs towards the inferior part of the body. That's the diaphragm, and it's got this weird look. It's a dome-shaped muscle. Origin, the lower ribs, as well as the lumbar vertebrae, forming these two components here. And then it comes off of the ribs and inserts into this lighter area known as the central tendon. So the insertion is not bone. The insertion is this central tendon. And this goes up high under the ribs. All right, so your diaphragm is not here where you feel the edge of your ribs. It's up higher. In fact, when I first started teaching the gross anatomy course at Sac State, I gave an exam, and tagging the mammary gland on a female cadaver is pretty obvious that you're tagging the breast tissue. So instead of doing that, I had an x-ray up, and the mammary gland, the breast tissue, shows up as what's known as the breast shadow. You can just see a slight kind of crescent curvature. And the student of mine, is an A student, missed it. And she was looking at it after the exam, and she said, "What is this?" She said, "I couldn't figure out what that is." And I said, "Mammary gland, the breast tissue." She says, "No, it's not." I said, "Why?" She says, "It's way too low." I said, "Okay, two things you're not considering. One, because you can see the diaphragm in the x-ray, the diaphragm is up really high. It's not horizontal here. And two, the older you get, the lower the breasts are. So you have a high diaphragm and a low sagging breast tissue, and that is the breast shadow. So when the diaphragm contracts, it actually flattens out. And that increases the superior-inferior dimension of the thoracic cavity. So raising the ribs increases anterior-posterior, lowering the diaphragm increases superior-inferior, and the thoracic cavity enlarges, lowers pressure, air is pushed in, inspiration. If you need to increase the diameter, you would use your sternocleidomastoid muscles, your pectoralis minor muscles, your serratus anterior muscles to help give additional force. And then when you breathe out, all of that relaxes. The ribs move down, the diaphragm raises up, the space gets smaller, and air is pushed out of the lungs. If you need to force it out, you're blowing a balloon, okay? You start tightening up, and you're using internal intercostals to pull the ribs even closer together. All right, so we'll stop there. Again, and we'll start with muscles that actually move the upper extremity. We probably won't get through all of them on Tuesday. In your quiz on Tuesday, we'll cover up to quadratus lumborum. So muscles of facial expression, muscles of mastication, muscles of the tongue, the neck, and the deep back, but not the superficial back or chest. Ready?